Hello, thank you so much for joining us. My name is Courtney and I work on the social media team. Today we're live broadcasting from Children's Hospital of Wisconsin, and we have a very valuable and important question and answer session and demonstration in store for you. Today I'm joined by Alli Thompson, an administrator for Project Adam, a program here within our Herma Heart Center. And we're going to learn about the importance of why we think every parent should know CPR and understand the importance of having AEDs in schools. So Alli, thank you very much for joining us. For those of you who are just joining in, please feel free to post your questions in the comments section of this video. We'll get to those as time permits. To those of you who have already submitted your questions, we look forward to answering those as we go throughout the broadcast. So for starters, Alli, can you just tell us a little bit about yourself and what you do here at Children's Hospital of Wisconsin?
Sure. So my name is Alli Thompson, and I'm the administrator for Project Adam, which is a part of the Herma Heart Center. So I have a really unique job because I get to support schools and communities and educate about the importance of learning CPR and AEDs in our schools and communities. So it's a pretty neat and unique job.
Great. And for those of us who don't know, can you tell us what CPR and what AED is, or what that stands for?
Sure. So CPR stands for cardiopulmonary resuscitation. AED stands for automated external defibrillator. CPR and AED are initiated if someone is not responding you'll know if they're not responding and not breathing. We want to start CPR as soon as possible, and we'll get into that demonstration and how to apply the AED.
Great. So you said you work for Project Adam. Can you explain for us a little bit about what Project Adam does for the communities?
Yes. So Project Adam stands for Automated Defibrillators in Adam's Memory. It began in 1999 after the tragic death of Adam Lemmel. He was playing basketball on a day in 1999, and he collapsed on the basketball court. When he collapsed, CPR was initiated, but there was no AED on site. Later, they found out that Adam's heart was not beating correctly. It was in something called ventricular fibrillation, where the heart is quivering. If an AED might have been available that day, it could have restarted his heart, but Adam did pass away that day in front of family, friends, and it was just a devastating loss to the community. His parents came to Children's Hospital in 1999 and decided that they weren't going to let another child die in that vein, and they wanted to start and get the awareness out about the importance of people knowing what to do in a situation and the importance of having AEDs in schools and communities.
So Project Adam was started here at Children's Hospital of Wisconsin,
yes.
and
yes.
then Adam stands for Adam, who's from around here, I'm assuming.
Exactly. And
That's
his
awesome.
family is still very engaged in the program, and we have 11 affiliates actually around the nation that are part of hospital systems just like Children's Hospital of Wisconsin and the Heart Center, and advocate for CPR and AEDs in schools. So it's a pretty neat thing.
So Project Adam gives the resources, or provides resources, funding. How does that kind of work in order to get these AEDs in schools?
Right. So Project Adam works with a number of community partners to help place AEDs, but we also work with schools to develop a plan if a sudden cardiac arrest happens, and develop a practice plan. So kind of like a fire drill, but they're actually running a drill to test their plan and make sure somebody is initiating emergency response, somebody is starting CPR, somebody is getting the AED, all before EMS can get there, because those first couple minutes when somebody collapses are what counts, and we need to intervene immediately.
So obviously CPR is an important part of that kind of process, but so are AEDs. Can you explain to us a little bit about CPR and what CPR does to the body in order to help fix the situation?
Sure. So I think the biggest question is, when do I do CPR? A person will not be responding, and that is when you would initiate CPR compressions. If CPR is needed, something is not going on right inside the body. Either the person's heart is not beating correctly or they're not breathing, meaning that blood flow is not circulating throughout the body and to the brain. So it's very important that something is done right away to restore brain function and ensure that nothing goes wrong with the brain as well. CPR is actually, the chest compressions are the biggest component that we're going to talk about today and actually demonstrate. But the chest compressions are actually compressing the heart, beating the heart for that person until help can get there.
So when you're pressing your hands, that's actually pushing on someone's heart,
Yep.
like basically showing the beat, or beating the heart for it.
Exactly. Because when somebody's not responding, we don't essentially know what the issue is. So by starting CPR and getting the AED to the scene as soon as possible, we're giving that person the best chance of survival.
Okay. And can anyone perform CPR? Like, how does it have to be someone with a medical background? How does that work?
Right. That's a really great question. Many people are hesitant to do CPR because maybe they're not up on their certification or they haven't sat down and done a training recently. Anybody can do CPR. It is better than no CPR. We'll talk about recommendations at the end because we do want everybody to go out and get a recent training, learn how to do compressions, and practice with the AED. But if you come upon a victim, start CPR, get the AED. There's definitely measures in place that protect us with the Good Samaritan law, that doing something is better than not doing anything.
And why do you think why do you think it's important that parents know CPR?
Right. As parents, we want to do everything that we possibly can to keep our children safe and to keep our family and the community safe. CPR can be used when we would least expect it, and hopefully you don't have to use it, but every parent should know what to do in a situation, whether it's their child, whether it's another child, or whether it's an adult at a community or sporting event. We should know what to do in that type of emergency.
And you don't necessarily know that someone has a heart issue or that your child, there could be something wrong with your child before, so it's good to be certified or to understand,
right, exactly.
Know the basics of CPR, correct?
Exactly. In Adam's case, it was a sudden cardiac arrest, so it did happen with minimum no warning signs. So a lot of times it will just be out of nowhere, so we need to be ready.
So one of our Facebook fans, Tiffany and Dana, had asked about the different types of CPR and kind of the ages that you perform CPR. I know there's a hands-only technique. Can you explain a little bit about the different types of CPR that there are?
Sure. Let's start with the hands-only technique. And just in the last couple years, there's been a lot of research that has shown that the compressions are the most important part and are going to do the most good in the shortest amount of time. So those compressions are, again, the most important part.
So that's pressing on the body?
Yep. Hands-only CPR is just pushing on the chest, in the center of the chest, hard and fast, until help arrives.
And that can be done on anyone?
And that can be done on anybody. Except when we're talking children, because we know that oftentimes there may be some breathing issues involved if they're not responding, we do recommend the 2 breaths. So 30 compressions and 2 breaths. And those skills you would learn in a certification class. And we'll talk about where to find one.
Is the 2 breaths otherwise known as like the mouth-to-mouth resuscitation?
Yes.
Okay.
Yes. So American Heart Association recommends hands-only CPR over puberty or age 8. So hands-only CPR, we want to use conventional with the breaths under 8. But again, CPR is better than no CPR. So we want to at least do those compressions.
That's great. Thank you very much. Yep. So you said you have a demonstration.
Let's do it.
Can you show us the hands-only?
Certainly. So right now we'll just go over the technique for doing the compressions, and then we'll actually demonstrate how to use an AED. Because remember, at this point we don't know what is going on inside the body. If it is an electrical problem, we want to get the AED there. In Adam's case, that AED, again, could have restored a normal rhythm.
Can you explain, just so an AED is generally, if you're at a school, you'd find an AED in a gym. Does someone run and go and get it? It's not obviously right at the scene, so someone's going to run to go get that. Is that how that works?
Yep, and that's what we work with schools a lot on, is developing a plan so that if somebody does go down, they know what they're doing in that situation, and they know where the AED is, and they're not scrambling. Great. So a lot of times the AEDs are placed in a very centralized location. In our hospital, there's one around the corner. In schools, a lot of times it's going to be by the front office or by a gym.
And is it that it's in that box, right? You put open.
Yep, it's in the box. It's safe for anybody to use. So get the AED off the wall, get it to the scene as soon as possible.
Great. Why don't you show us the hands-only technique?
All right. So first, again, I'm going to show the compressions on a hard, flat surface on the ground. That's where you're going to get the best leverage. So again, you're going to tap and shout, "Are you okay?" If there's no response, we're going to call 911 and start CPR immediately. We also want to send somebody to get the AED if there is somebody nearby. Today, the AED is already here. So again, I'm going to put one palm in the center of the chest, the other palm on top. or the other hand on top, and I'm going to push hard and fast to the beat of Staying Alive. And I won't sing right now.
That's a technique to remember, the Staying Alive, the beat of the song.
And for viewers, it may be difficult to see how deep are we supposed to get. At least 2 inches, all the way potentially up to 2.4 inches. So again, we are trying to circulate blood for this victim that's not responding, so we need to push hard and fast. If we're just delicately pressing, that's not going to do the job. We really have to push hard and fast, so nipple to nipple right in the center of the chest, just like that.
One of our Facebook fans, Samantha, had asked where. So no matter the size or whoever it is, it's nipple to nipple on the chest, right in the middle?
Right, just the center of the chest. Just think the center of the chest. If you take a training or a certification, you'll learn more and be able to practice that placement on an actual live mannequin, which is what we recommend.
Great. So as you're pressing on the chest, when is the time that you pull out the AED?
Okay,
Use the AED?
Great question. So we want to keep doing compressions while the AED is being applied. So for the sake of the demonstration today, I'm going to do a couple compressions and then I'm going to actually place the... Okay, the person is not responding. The AED has arrived. We're going to look at the pads.
By removing all clothing. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
On there. Okay.
No one should touch the patient.
And this is the part where we do step back.
Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flat shock delivered. Be sure emergency medical services have
So it
been
even
called.
reminds you.
It is safe to touch the patient. Begin CPR.
And it'll
For
tell
help
you.
with CPR, press the flashing blue button.
And most AEDs are going to have a feature where it tells
Place
you how
the
to do
heel of one
CPR if you
hand
forget.
in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
So you're going to do that, and the whole point of every parent, every community member, anybody to know bystander CPR is because we can intervene before EMS gets there. When EMS arrives, they will ask us to clear out of the way, and they will take over. So a lot can be done in a few minutes to help.
And anyone can do it. You don't have to be trained to use an AED because the AED gives the direction.
Right.
So you just open it up and it's telling you
Right.
where to place them. And I see on these pads there's little images, so it's showing that this one goes before the left breast and this one goes above the right.
Yep. So we do urge everybody to get trained, but again, you can still be part of that rescue by getting the AED off the wall, getting it to the scene, be part of that rescue.
Okay, so can you explain a little bit about like a training and then getting certified, about the process of how our parents and all of our fans, now they want to get
Right.
certified. They want to,
Right.
they want to put the gold star on or whatever they need to do.
Right. So training, Project Adam does training in schools and communities. So we actually have events and different opportunities where we teach hands-only CPR, how to use an AED. We also work with school staff to kind of go over that response plan. That would be considered a training. So you're getting the education, you're getting some hands-on with bystander CPR, you're trained in CPR. The certification would be that you're actually sitting down in a classroom, and we do our training sometimes in a classroom too, but certification, they're following American Heart Association, Red Cross, or Health Safety Institute guidelines, CPR guidelines, and making sure that you get plenty of hands-on practice. It'll be anywhere from 2 to 4 hours, a CPR and AED certification
Just one day?
class. Yes.
And then do you have
Certainly.
to take like an examination, or how does that work at the end of it?
Right, and they vary. The bystander CPR one, the most basic heart saver or basic life support, there will be sometimes a written test at the end, but a lot of times the facilitator or instructor will do the hands-on at the end, so everybody will somewhat test
Practice
out.
it. Yep.
But it shouldn't be an intimidating process, and it should be something that everybody is empowered to do, and not a scary class to sit in. It should be empowering.
So when you go through your trainings and certifications, do those ever expire?
They do. Usually every 2 years to keep up on those skills, especially because the guidelines change from time to time. So we want to make sure that everybody knows, is it 30 to 2? Is it, we're pushing hard and fast. But again, what we want to urge today is that people remember to push hard and fast on the center of the chest and get the AED.
Okay, and do we have any questions from our fans, Corey?
Yeah, Laura asked, I thought it was recommended not to do breaths anymore on anyone due to risk of spreading diseases if victim vomits, such as hepatitis.
Okay, Laura, that's a great question. And still the conventional CPR with the 2 breaths is recommended. In certain situations, that's why bystander or hands-only CPR is so important, because if there are concerns about vomiting or fluids coming from a victim, we know that we're making a difference by doing those compressions and getting the AED. So it is still recommended in certain situations, and if you take a certification class, you will learn how to do the sequence with the 30 compressions and 2 breaths. But great question, Laura. In some cases, it may not be in the best interest to do breaths.
Great, awesome. Well, any final thoughts for our parents and anyone who may be viewing this video?
I urge you all to go out and get training or certification, and we're growing our events for Project Adam in the community throughout the state of Wisconsin. I also urge you as parents to make sure that your child's school has an AED, has a plan, and has a team that can respond in the event of a cardiac arrest. Even if we don't have kiddos with high risk chance for a cardiac arrest, we all need to be prepared and be ready to respond in that situation.